All right, welcome everybody. Give everybody a few seconds to join. We appreciate you taking the time to be here with us today. We try to do these webinars monthly as often as we can through DefibTech, and our topic this month is how organizations and groups are working towards preventing sudden cardiac death in 2024. And just a couple housekeeping things before we start. So we always record these webinars. So we will record it, and within a week or so, it will be uploaded to our YouTube channel, which is just DefibTech LLC. And then if you have any questions as we go, there's a Q&A box at the bottom. Feel free to enter any questions you have, and we will answer as many of them as we can before the end of the webinar. So today I'm really excited because for a couple of reasons. I think we have two of the most influential people in the cardiac arrest prevention world with us. Two people personally that have had a great impact on my life. So we have Mary Newman from the Sudden Cardiac Arrest Foundation and Martha Lopez-Anderson from Parent Heart Watch. So thank you both for taking the time to be here and do this with us today.
Thank you. Thanks for the opportunity.
Yeah, so I think to start, and I think most people probably know both of you and know both of the organizations, but I think it'd be great to just give a quick intro. So starting with you, Martha, you just want to give some quick background on yourself and some quick background on Parent Heart Watch?
Sure. So I'm the executive director for Parent Heart Watch, the national voice solely dedicated to the prevention of sudden cardiac arrest and death in youth, which is children, teens, and young adults. And I also lost my 10-year-old son, Sean, to sudden cardiac arrest due to an undetected heart condition. And so about Parent Heart Watch, again, national organization with members right now in 40 states and who are doing fantastic work to help, again, achieve our mission and vision. And so, yeah, but thank you for the opportunity today, Mike.
Yeah, definitely. Mary?
My name is Mary Newman. I guess we know that. And let's see, I got involved in this field a long time ago just because I thought cardiac arrest is something that we can fix. I mean, as far as survival rates go. So that just got my attention. So I worked in different iterations over the years in this field, and then started the Sudden Cardiac Arrest Foundation in 2005. So we're 18 years old now. And so I was, only 5 when I started it. So it's really amazing. No, anyway, but our mission is to raise awareness about sudden cardiac arrest and help save lives. And increasingly, we're working on supporting people personally affected by sudden cardiac arrest.
Awesome. Cool. Great. Okay. So, our goal, I think today is just to kind of talk about, definitely some work that both organizations are doing and kind of looking forward to what we're kind of moving forward and new goals we have for 2024. So Martha, I want to start, we just came off, and I was fortunate enough to be there, your annual conference, Heart to Heart. And this year you added a think tank, which focused on the pathway to survival for sudden cardiac arrest and use. So can you start by just giving some key takeaways from that think tank?
Yes, and so for everyone to know, we were very privileged to partner with the Cardiac Safety Research Consortium out of Duke University to make this think tank happen. And I think one of the biggest takeaways from the think tank is the incredible work that's being done to advance preventive ECG heart screenings in youth. From the pilot, the study we have going on with the CSRC, and then most recently with the military 3-year pilot that was just approved as part of the National Defense Authorization Act, or NDAA, to screen recruits. I think that's a huge step forward. In addition to that, I think also the agreement that there is complete consensus that kids of all ages should be empowered with, CPR and AED skills, and that is a good thing. And in addition to that, the importance of cardiac emergency response plans, and the perfect comparison to that is how fire drills are mandated, right? schools are required to do fire drills, when in one 4-year time frame, there was only one death. And we know that, we're losing both adults and children alike on school campuses and other places. And yeah, we have to make this a priority. One thing that really was interesting was to see also how other countries are doing it. And Japan in particular, who's currently screening their students in 1st, 7th, and 10th grade. And they've been doing so since 1995. So I think we have some lessons to learn, right, from our friends in Japan and other countries. But I think those are, from my perspective, the key takeaways, together with the fact that this think tank was much bigger, which also shows how many more are recognizing the importance of affecting change. That is not okay for young people to die when we can prevent it, whether it's through primary prevention or secondary prevention.
Yeah, I love that. I think that is the key to talk about, is that primary and secondary, it's a combo. You're never going to detect everything. If you can, it's great. And we just need to have complete plans, not just having an AED, having the cardiac emergency response plan, having as many people that are comfortable providing CPR. Awesome. So Mary, I want to, talk a little bit about one of your big initiatives over the past couple of years. And, I think this kind of came at a great time when the American Heart Association, adds recovery into the, the chain of survival. And I don't know that there's a lot of great resources out there for sudden cardiac arrest survivors, but you've created one through the Sudden Cardiac Arrest Foundation. So can you talk a little bit about the Sudden Cardiac Arrest Foundation's Cardiac Arrest Survivor Alliance, and just kind of how it's helped survivors as they, move on from sudden cardiac arrest?
Sure. Sudden Cardiac Arrest Foundation has worked from the very beginning. We had a survivor network, but in last January, just a year ago, we launched a new platform that is much more technically advanced and powerful and user-friendly. And so in the first year now since we launched this program, we now have about 1,300 members from the US and 24 other countries. So, and we've done some promotion light, I guess you would say, through our own outreach through Sudden Cardiac Arrest Foundation outreach, and also at various conferences. We had a paper that we presented at the Resuscitation Science Symposium on this, and also presented at the Cardiac Arrest Survivors Summit. So we are getting the word out there, and the platform includes resources to help people affected by cardiac arrest, including survivors, co-survivors, or friends and family, lay rescuers, advocates, and people generally interested in the cause. So of those 1,300 members, about 75% are survivors. And it's really remarkable, the engagement level. We've been offering monthly webinars. Our next one is next week with Tom After Heidi from the Medical College of Wisconsin, who'll be speaking about ECMO. But anyway, we have seen that you can measure engagement through the platform, and we are seeing that there's a great deal of interaction, not just publicly, but between members through direct messaging. And a lot of people have said they've made some great friends in this space, because previously a lot of people have said they thought they were the only survivor. They didn't know there were others out there. And then people are talking about their circumstances, and if you can relate to such and such, then you'll reach out to that person. So it's going really well, and we actually received support from the American Heart Association for the program.
That's awesome. Yeah, I mean, I am a survivor and a part of it, and I get daily emails and updates, and it's just feel like it's a combination, and it's part of your treatment. You have your great care from your doctor, and then now you're able to ask questions and relate to people that have actually gone through what you're going through, which is really, really important. Cool. So Martha, going back to Parent Heart Watch, and I think one of the cool, and you mentioned this a little bit, is the nonprofits out there that are kind of boots on the ground in their community, like working on the mission. And, what do you think the big takeaway for those organizations was kind of next steps going back into their community? What was the big focus this year after the event?
I think the most important message and takeaway is the importance of working together
Hmm.
collaboratively, and
Hmm.
not just Parent Heart Watch members, but engaging others, right? This is the only way that we're going to change this paradigm of sudden cardiac arrest in youth. And so our members, obviously at the state level, are doing phenomenal work with both education and awareness that are paramount to the work that we do, but also facilitating, heart screenings, providing CPR and AED training and AED placements. But again, the collaboration is huge. And I think that's, I know we're going to be talking about that later on. So,
Hmm.
but I think that 2023 taught us a lot of things. And
Yeah.
so I'll stop there.
Yeah, yeah, it probably leads right into the next question. And so it was like I said, it was a heck of a year for sudden cardiac arrest awareness, right? Started really, right on the new year on January 2nd, 2023 with Damar Hamlin. And
Mhm.
then, Bronny James had his incident. And, I know we all feel the same way about the importance of this awareness, but like anything that happens in the world, there's like hot topics that people love talking about, and then like something else happens and those topics kind of get pushed to the side. So my question for both of you is, what can we do to keep the momentum going, and not let, cardiac arrest kind of slide to the side again? And that might be easier said than done, but I just want to get your thoughts. Mary, if we can start with you.
That is a great question. I have to say, after Damar's event, our website traffic, like I'm sure everybody involved in the field, just went crazy. And we ended up hearing from different news outlets. We had actually NBC News and Newsweek and others doing stories about cardiac arrest. And it's what I'm seeing anecdotally is that people are now referring to cardiac arrest, not just heart attack, which it
Mhm.
always used to be just about a heart attack. And journalists are asking for information about cardiac arrest. So I think that's a huge achievement. But I think we just have to keep pushing the message out there that sudden cardiac arrest is a treatable condition, a preventable condition, but the lay audience, the lay people are the ones that need to learn what their role is. So I think if we can keep pushing that message that the person that's nearby needs to start taking action right away.
Yeah. Yeah, I think we learned that was one of my biggest takeaways from we watched the Mars incident and we watched how great his care was. And I think just turning that word, people don't have to be lucky to survive. If people are prepared, more people will survive. And also it's incredible medical staff, both Buffalo and Cincinnati, but it doesn't have to be that. You need one person really who is in an AED, and you need someone that's witnesses it and is going to start doing CPR and use the AED as soon as possible. So, but anyway, Martha, what are your thoughts on keeping the momentum going?
Well, I think that one of the most important things, and I'm going to reference the National Institute of Medicine, A Time to Act, you know, um, increasing survival rates, A Time to Act report, which really indicated that the silos are not helpful, right, in keeping our cause moving forward.
Hmm.
And so one of the things that I think that we can all do better is work together. We can maximize our resources, but more importantly, that we say the same thing so that we are not part of confusing the general public.
Hmm.
And I think that's really something that I hope people hear loud and clear, the importance of all of us, making a real effort to, again, be consistent and unified in our messaging. That is really, really important.
Yeah, I agree. And I want to take a quick second. And I think that's a big part of what both of you have started with Call Push Shock. And can we talk about that really quickly? Just because I think that's really important, right? Is making sure that we do have a unified definition of what is sudden cardiac arrest. I mean, it's as simple as it just goes with like stop, drop, and roll, right? So it's a
Exactly.
universal message. So,
Yeah.
can you just talk through the Call Push Shock campaign a little bit, Mary, if you want to start, and kind of what it is and
Yeah.
how people can learn more about it.
Well, based on the Institute of Medicine advice to speak with one voice, we ended up coming up with Call Push Shock. And we had conducted consumer research prior to the IOM report. We had conducted consumer research to determine public awareness of cardiac arrest. And not surprisingly, it's extremely, at the time was extremely low. And out of 1,000 randomly selected people in the US, 0 considered sudden cardiac arrest to be a top priority or health concern for themselves or their families. And then after the IOM report, we repeated the study, but this time we looked at messaging. What messaging resonates with the public? And this time it was 2,000 people in the study. And unfortunately, still, most people didn't realize cardiac arrest is a big deal or never really heard of it. But the messages that resonated the most with the public were the fact that you can double or triple survival rates if, as a layperson or the person at the scene, you get involved right away. That message made a big difference to people. And then secondly, the fact that most often occurs in the home. So the chances are the person you're going to be helping save is somebody that you love. So those were the two big messages. And then we did some man on the street. Are you allowed to say that? Interviews, and the demonstration demonstrated how to use an AED, and people were like, oh, that's all I do? Turn on the button and listen to instructions? I could do that. So that was the basis for the campaign.
Yeah, yeah, definitely. Martha, do you have anything to add about Call Push Shock?
Yeah, I think, the importance of people recognizing and responding to sudden cardiac arrest, and again, keeping it, simple. So what are the things that lay people, can do? And I think that has been done, through Call Push Shock with the messaging that has been developed, the different assets, which are available for anyone to use, by the way. And I think for those that are interested in learning more and utilizing these assets in their communities, I urge them to visit callpushshock.org. And one of the things that I will say too is that the Call Push Shock movement has includes nonprofit organizations, businesses, universities, municipalities, EMS agencies. So this is really for everyone to use. And so please, please, please visit callpushshock.org. And we also welcome any feedback that you may have on the campaign assets.
Yeah, yeah, and I can speak to it. I mean, I've used them. We've used them here at the FibTech, and I know our nonprofits have used them. Um, they're very powerful images, and it's a very powerful message. It's great social media assets, and it's just a really great thing to take advantage of, especially again, like we talked about, we have good momentum going with sudden cardiac arrest. So I want to, you all have both been working at this, and put a lot of time and effort into this. And I want to, think about, or for you to think about, what are some things that you've seen that have been like really positive changes since when you first started to where we are now? What are some things that you're proud of? What are some things that you have seen that have been like really positive changes that have brought us kind of going in the right direction? Martha, if you want to start with this one.
Wow.
So,
Yeah, I think the simple acknowledgement by many now that SCA, sudden cardiac arrest in youth is not rare, that happens. It's been happening for a long time. Also the dialogue around warning signs and risk factors, and recognition sudden cardiac arrest and the early detection ECG screening in youth. I think that I can tell you that when I came to Parent Heart Watch, I could count on one hand how many were doing screenings across the country. And that has changed significantly. Likewise, also the availability of AEDs. We come a long, long ways. I mean, when my son collapsed and AED wasn't available, the first on the scene was a police officer. He too was not equipped with an AED. And now that's changed greatly. Many police officers are equipped with AEDs. Communities are recognizing the importance of having these available, publicly accessible. So even though for those that are recently impacted by sudden cardiac arrest, it may not seem that change has happened, we've come a long ways,
Yeah,
but we still have work to do.
definitely. Mary?
I definitely agree. As I mentioned, more and more media are recognizing cardiac arrest, and that's the DeMar effect primarily.
Yeah.
But I personally have found more and more just an everyday interaction with people, like an Uber driver recently, asked me why I was in town, and I told him for a conference, and he's like, cardiac arrest that can happen to anybody, right? And like, everyday people saying, I've heard about that, and I think I need to learn CPR. I'm like, good, that's
Yeah.
great.
Yeah.
But yeah, and also the laws across the nation that are changing to make it more universal, that students have CPR training and AED training prior to graduation, that the laws that are encouraging AED placement in schools and sports fields and places of high, what's the word, Martha?
Assembly.
Thank you. High assembly. Yeah. So, yeah. And that's another thing about CASA, Cardiac Arrest Survivor Alliance, that so many of the people there want to pay it forward and they want to get involved in the cause. And that's a big change. I mean, I can remember at a conference a long, long time ago, I was looking for if I could only find 3 survivors to speak at the conference. And it took a lot of work. And finally, we came up with 3 people. But now fortunately, we have many survivors. And, the Cardiac Arrest Survival Alliance Summit, rather, was really interesting because there were so many survivors there.
That is amazing. The Uber example is a great one, because I feel like for a long time, if you said cardiac arrest, and you still have to do this sometimes, but it's a huge educational thing. Someone would say, "Oh, what's that?" And like, what does that mean? Is that a heart attack? Is that, and you have to really educate somebody. And I do agree that there are more people. It used to be like you don't really know it unless you've been affected by it, someone. And now
Yeah.
it does feel like there's more people that do understand it better. So I know we talked a little legislation. So, and I think, Martha, this was talked about at Parent Heart Watch. There were 13 bills passed just this year in 2023. So my question for both of you is, what kind of AED legislation would you like to see in the future? And I know we kind of have the Access to AEDs Act going on right now, but is there anything that you would like to see kind of happen either state by state or federally in the future that could really move the needle for us? Mary, you can start.
Well, we're Parent Heart Watch and Sudden Cardiac Arrest Foundation are both members of the Smart Heart Sports Coalition, which is spearheaded by the NFL. And I think that that group it's great because there's a lot of collaboration among a diverse group of organizations working together to get legislation passed. Mostly the focus is on sports. What happened there? Sports venues and for high school and colleges. So I think that's a positive step. I really just think it should be universal that students learn CPR and AED use prior to graduation. I don't understand why anybody would be opposed to that. And the usual excuses because of cost, but it doesn't have to cost a lot to at least make sure kids understand the basics like they do in other countries, Norway, for example, having people trained at multiple years throughout their education. So
Definitely. Martha?
So I think legislation is great. I think one of the biggest challenges with legislation is that it's most often unfunded
Mm,
and that there is no consequence for noncompliance.
that's
And
true.
so because of that, I really think that obviously we have to tackle this from the top down and bottom up, any which way we can. And so one of the things that we're focusing on is on changing the life safety code to include AEDs. And the life safety code is utilized by cities and counties nationwide. And that's really, that would be a game changer because, that again is utilized nationwide as opposed to going state by state. And the laws in each state regarding AEDs vary greatly. Um, and so I really feel that um, changing the life safety code is going to be uh, a really great approach to see AEDs readily available, just like fire extinguishers are.
yeah, awesome. Okay, so kind of gonna move over to talk a little bit about, we touched on this a little bit before, is more people, we need more people that are willing to act, right? Lay rescuers. So the first three links in the chain of survival are all occurring before an ambulance even shows up. And that's relying on the general public to
Mhm.
to step up. So, and I know we kind of talk about certification versus training and all that, but I just want to kind of get your thoughts on, how can we, make more people comfortable? What are some things we can doing or messages we can be getting out there that would push more people to step up and provide CPR or use an AED if necessary? And Martha, we can start with you on this one.
I think, again, copper shock. I think we
Yeah.
need to empower everybody, including, we can't wait for kids in high school. We have to start earlier on,
Mhm.
just like stop, drop, and roll. While little kids may not be able to perform effective CPR, they're perfectly capable of calling 911 or getting help or going to retrieve that AED. So I think we need to start in elementary school so that this becomes, it's not like a foreign subject to them. And we wait until high school when they already have some preconceived ideas, right?
Yeah.
So, yeah, we just have to make this, and take away, make people feel comfortable. But we also have to be mindful that, and when we're putting information out, that people need to see themselves represented in any materials that we put out, right? And that includes minorities, females. And so yeah, but I think I think that we're starting to see that turn a little, but we still have work to do. And I think again, it's about that consistent, unified messaging.
Cool.
Great.
Mary?
I agree. One thing I think that's positive for the future is, or even now, is that young people are very comfortable with technology and they're not going to be afraid to use AEDs like
Mhm.
maybe, older people might be. So I think that's going to be a positive change going forward. I think that's maybe the big fear of using the AED will be dissipating in time if it hasn't already with young people. So I think that's a positive thing. But I agree, the main thing that we're trying to get across is for everybody to remember call, push, shock, and join the movement. We have about 50 people in there, 50 organizations now. Let's keep growing that so that all communities are aware of it in some way. So we need to keep pushing that message out there.
Yeah.
And I want to give kudos to we all of our co-partners utilize the call push shock assets, but I want to give kudos to the city of Bexley, who have become incredibly creative, and they're putting street banners with call push shock. I think that that is what it takes, is for people to see that, for it to be in front of them. And so, yeah, I think that we need more of that, more of the call push shock messaging, and where people feel empowered, and this is not so, there's no fear to act. So yeah, I just wanted to mention that because they've
Yeah.
been very creative, and we really
Yeah.
appreciate that.
I am
Yeah.
familiar with the Heart Safe Bexley program, and it is awesome what they've done. But I have a thought too that about, starting CPR training at a younger age. I randomly just read a book within the last year called Beginners, and it's all about like learning like new skills when you're an adult. And it was really cool because like it makes you want to, like, it's like someone that's never swung a tennis racket, and all of a sudden, when you're in, hit his age, you're like, hey, I want to take tennis lessons. It's much harder for that person to learn how to swing a tennis racket than it is for a 5-year-old that says, hey, I want to start swinging a tennis racket and taking lessons. And it's the same exact message. It's like, and that's because like when you're an adult, you already have, I think Martha, you said, preconceived notions about things. You already have learned how to do things a certain way. So it's hard to like kick those habits of like, um,
Mhm.
being able to do something really, really well, and whatever that is, playing an instrument, whatever the skill is. And I think that's similar to CPR, right? If we can get kids at a really young age just comfortable with calling 911, providing chest compressions, it's going to be something that just is easier. And I think that's like scientific, like that's a scientific, like, proven fact that like it's easier to learn things when you're young. So it is a great approach. If we could, I think we said maybe in Norway they're doing it, where you're like getting CPR education at points in your education, whether it's once in elementary school, once in middle school, once in high school. It makes a lot of sense, and it just made me think of that book that I read, and it goes in line perfectly with that. But just a thought I wanted to say before I forgot. I forgot it.
Yeah,
But yeah.
if I could add to that, Mike, that one of the things that we also need to keep in mind is that everybody doesn't need to be certified
Yeah.
in
Yes.
CPR and AED use. I think that the goal is to empower people, right, to
Hmm.
where they feel comfortable and confident in rendering aid. And so that is really critical. And it's been proven that brief and ultra brief demonstrations and trainings are just as effective as sitting in a long,
Yep.
8-hour class or whatever. It's like, let's just keep it simple. And also, shorter, more frequent,
Yep.
shorter, more frequent. That's
Yep.
that's what we want.
And I think that's a great point, because I think, we talk about this every day. And
Mhm.
sometimes I have to like remember that. Like I talk about AEDs, I talk about CPR, I talk about cardiac arrest every single day. Someone that is, has a job and they have to get CPR training for their job is doing it once every 2 years. And a lot of times they're not talking about it at all in between those two classes. So I do agree with more frequent training. And yeah, I think we need to help make sure people understand, like, it's great if you get certified. Obviously, it's awesome to go through that, but you don't need like that card to help save somebody's life.
Mhm.
I think there was an article. This is kind of a silly example, but there was an article about someone that, and you don't learn much from the Office CPR episode, but someone was like, "Oh, if someone collapses, I start doing CPR on them," and it's like that's as much knowledge. Like anything is better than really nothing at that point. So, I think it's a great point. So, all right, couple questions to wrap up. So, I feel like we've been using this, and I'm sure we've touched on a lot of things that kind of go in line with, this question, but, we've kind of been using this number of like the survival rate of cardiac arrest being right around 10% for a while. Since I've been doing, been involved in the industry. And, I guess, again, we've talked about some of them. What do you think are the big things that need to happen this year in 2024 to try to get that number above 10%? And Mary, we can start with you.
I mean, the biggest thing I think is just uh, working on awareness of the general public, more and more emphasizing it's up to you. And like you said before, Mike, it shouldn't be about luck,
Hmm.
whether you survive. It's not a matter of luck. It's a matter of education, awareness, and taking action, and not waiting for the next person to get involved. And you take charge. You send somebody for an AED, that kind of thing. So I think that's going to be the biggest thing that we could do, is to get through to the general public that you have a major role here in saving lives.
Definitely. Definitely. Martha?
Yeah, I think that I'm hopeful in 2022 and 2024 that with the collaboration and partnerships with others, and even though the Smart Heart Sports Coalition is focused on athletes, I think that clearly they have a very high reach, and so just imagine if we could expose to people in stadiums to quickly how do you do hands-only CPR and how to use an AED, and just giving on the messaging, the call, push, shock. If we expose them there, if we could have billboards along the way for people as they're driving to see, a PSA on TV, on the radio. We're going to have to use different channels to make this happen, but the message has to be consistent and everywhere. We really need it that way, because I think we have people's attention, even though that's a little disheartening because SCA has been happening for a long time, but I'll take it. And it's upon us to take advantage of that.
No doubt. So I had, before I get to my last question, I had a question that came through, and it just was, is there a model of some kind that communities can use to develop and implement a plan for improving outcomes at the local level? Just is there anything out there that people can follow to,
Is that referring to a cardiac emergency response plan or
yeah,
emergency action plan?
yes.
Yes, so I will say that we worked with the American Heart Association and other health and safety organizations back in 2015 to create a template and implementation resources. And we reconvened in 2023 to update that template and implementation resources, but not only for schools, but for places of worship, for businesses, for anyone that wants to be prepared and have a plan. And so that should be coming out in February. So stay tuned.
Awesome. Cool. Okay, so last couple questions. So, Mary, what are one big goal, a couple goals that you have for Sudden Cardiac Arrest Foundation for this year?
I think our primary goal right now is focused on CASA, Cardiac Arrest Survivor Alliance, and trying to add to the resources that we have on the platform. We have a really strong scientific advisory group that has taken scientific research and written it for the lay public. So we have those resources in there, and we'd like to increase those resources, and also, get the word out there, working with, for example, with discharge teams at hospitals, electrophysiologists, so that when people leave the hospital, they are given information, and they're not left alone, with a pat on the back, have a good life kind of thing, but they can go forth and feel that they're going to be supported in their journey. So I think that, I would say, is our primary area of interest, but we're still, Sudden Cardiac Arrest Foundation focuses on being a strong information clearinghouse on sudden cardiac arrest, always adding to the website with news and information. And I think that will continue. And then again, call, push, shock.
Mm-hmm.
So I would say those are the three areas.
Cool. And Martha, what are the big goals for Parent Heart Watch in 2024?
So we really want to work on increasing the implementation of cardiac emergency response plans in schools and other youth serving organizations through our Get Charged Up program, which not only helps them implement the plan, but upon completing the milestones of the program, they receive an AED with the necessary accessories, a wall cabinet, signage, and rescue kit. In addition to that, working with our members throughout the country and leaders to affect change in specific states that are still lacking key safety policies and data reporting. For example, we still have states that are not reporting to CARES, and we really need CARES to be in all the states in our country so that we really have a good grasp of how sudden cardiac arrest is affecting both youth and adults alike. And also, one of the things that this was came out of our heart to heart is engaging our members in hospital systems and others throughout the country to hold a national heart screening day. And so, I think people are really fired up about that. They want to make that happen. And we're going to see that it happens. So, and like I mentioned earlier, is working to affect change at the National Fire Protection Association by making AEDs part of the Life Safety Code.
Awesome. Cool.
I want to
Yeah.
add one more
Please, yeah.
thing. The first week of June is CPR AED Awareness Week, and Ed Kozik, who is with Every Second Counts CPR, and also he's a member of our board of directors, is leading the charge to have a major event on June 1st in Washington, D.C. that will be continuous CPR with teams. I think he wants to go for 12 hours straight of CPR. So people are encouraged to follow up and with him and come to DC June 1st.
That's awesome.
Yeah, more information will be coming out of that. So it's the National CPR and AED Awareness Rally and March, May 30th and June 1st in Washington, D.C. Advocates from across the country will be there. So join us.
Yeah. Ed's everywhere.
Yes.
Yeah, he is.
Everywhere. Yeah. He's in multiple places at once, I think.
Yeah. Where in the world is Ed Kozik?
All right. So last thing, just I want to, you guys have such valuable information and have done, done so much and have so many good resources. Can you just take a second and just tell people where they can find you, website, social media, anything that you think, that people can reach out, contact? Mary, you can start.
Okay. Sudden Cardiac Arrest Foundation's website is sea-aware.org. And there you can see links to our various social media channels. And the Cardiac Arrest Survivor Alliance is casahearts.org. So that's where I would start with our resources.
Awesome. Martha?
So our website, parentheartwatch.org, is a great resource with a wealth of information where you can find info about CPR AED trainings, AED placements, cardiac screenings in your area. Also, for those that are interested in joining our efforts to protect and save young lives, join us. You can do that through our website. And if you want to support our efforts with your generosity by making a donation, you can do that through our website as well. And then we're really on multiple social media channels: Facebook, Instagram, Twitter, LinkedIn, YouTube. So yes, contact us anytime.
Awesome. Awesome. Well, thank you both so much for taking the time to do this. This was such valuable information, and you all are both such a force and have had such an impact and helped so many people and saved so many lives. So thank you for taking the time out of your schedule to do this. Just a reminder to everybody, we are recording. We are going to have it on our YouTube channel. So feel free, once we get the link out, to share it with family and friends that this can benefit. And we thank you for taking the time to join us today, and everybody have a nice day.